Welcome to the LowCarbUSA podcast, where we seek to inspire you to help us build this community. I'm Doug Reynolds.
And this is Pam Devine.
Okay, so let's get this going. Christian, welcome. Thank you so much for making the time in the middle of the night for you pretty much to do this talk with me. I know you're so busy.
Pleasure.
But something that's interested me, and I think will interest a lot of other people, is how you discovered this and why and how you've introduced it into your practice.
Well, I'm for the people to know, I'm an interventional cardiologist, and I think I've always been a active guy, a sports guy. I always look for my health. I like looking good. I would say vanity. There's a certain extent that I always thought or think that vanity helps people achieve certain goals of health. I mean, not many people throughout my training would care what their labs look like. They would care more what they look like in the mirror. And I think just concepts, and that was the first thing that hit me. I mean, and I think it was 2017. I told this in a podcast with Vinny Tortorich, and it's like I was getting the dad bod. I'm like, hell freaking no, you know. I'm following my recommendations. I'm like really decreasing my caloric intake. I'm getting this apps to track my calories and eating cereal or grains and the oatmeal and skim milk and just trying to keep it as light as possible. The end of the week goes by, and so what the hell's going on here? I'm not losing weight and I look the same, but I just feel miserable. So that's when it hit me. It's like, you know what, this stuff is not working. I'm active, I work out, I exercise, I try to behave as much as I can. It's not like I'm abusing anything. So, I mean, if the definition of insanity is trying the same thing over and over again, expecting a different result, well, that's what actually got me into doing something different. Now, I must admit, when I first tried this, the only thing I did is I had no idea about low carb, ketogenic diet, the physiology about it. Um, I just said, you know what, I'm just going to decrease my calories, my carbs. And that's what I did. At first, I just decreased it to 100. Why 100? I have no idea. That number just came to mind. Then 100 turned to 80. Then there's, for people that want a more prolonged story, they can go to YouTube, Med Hacker, and I did a video for the American Heart Association regarding this. But, and long story short, I just started decreasing the amount of carbs. And then what I noticed is, like particular days, I was actually prolonging my breakfast. And then I forgot, and it was 12 or 1 p.m. already, and I hadn't eaten breakfast. I'm like, before I suffered migraines since I'm 12, and now I'm skipping breakfast. I'm not getting migraines. I have the energy, unbelievable energy, and I'm just shedding weight. You know, I mean, I lost about 30 pounds in 3 months. I felt extremely energetic. My migraines were gone. I had a lot of focus and energy, and that is what initially I actually wrote a post, and I'm like, hey, I discovered the Holy Grail. I thought I had been I had discovered something, and well, as you start reading, you realize it's like, Jesus, dude. I mean, this has been going on since 1850.
Yeah.
But that is the most pathetic thing of them all. Why don't we hear about this stuff in med school, in training, in fellowship, and residency, when it has such a tremendous power? So I was telling to you about, so I had this like significant changes in my overall health. Even my brother's like, what on earth are you doing? I mean, he's also like a sports Billy and loves to exercise, and he could not believe the changes that I underwent. And so people started asking me, what are you doing? Friends, family, cousins. And I'm like, you know what? Now I know this is something called intermittent fasting, and I'm combining intermittent fasting with low carb, and I'm basically developing moments of ketosis by doing so. I'm not, I, the only day that I tried to count or quantify my fat intake was the last day I did. It's like I remember getting a ribeye, trying to weigh in and figure out my grams. So I'm like, hell no, I'm not doing this. So I can tell you I've never quantified anything. I firmly believe in listening to my body. And once you're giving it good food, real food, whole food, the body responds physiologically and tells you when you should be eating and when it should not. And this is my experience with patients. So
Can I just chip in quickly here? You said that you kept reducing the carbs progressively.
mm,
Um, did you start adding healthy fats back in automatically, or did you only start
you
doing
know, I
that
think the
once?
body, you do that on your own without even thinking. Like if
Okay,
you
so
remove
it just
carbs,
happened automatically.
so I just eat more salmon. I was eating more vegetables. I was
Right.
eating more greens. So I was basically I focus on green vegetables and any animal. That's my summary. So I say, you focus on the fruits that end up in airy, 2 handfuls. You focus on the green vegetables, nothing that grows beneath the earth, and you eat any animal that you want. Now, if you're vegan, good luck. I mean, you can figure that out. I mean, I'm not. I mean, I really don't. Besides my Hispanic population, I'm Mexican. We don't do vegan. I mean,
No
if
one's
you
vegan.
find one Mexican that is actually gonna live carne asada alone, well, that's a rare species, you know. So
Yeah.
it's because of my setting. But if a patient wants to do vegan, I mean, I support any way of eating, and I try to find what works best for my patients. But in this aspect, what I did is, so in 2011 approximately, there was a publication, as I was telling you, which obesity is spread through social networks. The author was James Fowler. And it's a very interesting study. Like if you have a sibling or a wife or a spouse, you have like a 30% chance of developing obesity, up to 40, 50%. So even if your social networks, it's very interesting. Like if you have your friends and your friends are actually smiling in your profile pic, like you have a higher chance of actually being smiling in the profile pic. Like it's like those things that get engraved in us. So I said, you know what? Well, if that is spread that way, well, the same thing to a certain extent, the research showed that it applies for healthy. So if you have like a healthy subgroup, you were more likely to be healthy. So what I wanted to do with this is like, you know what? I'm going to use like this type of social network and spread healthiness. If I mean, and so my friends, my family, my cousins is like, hey, I want to do this. It's like I don't have the training right now to tell you exactly what to do. I can tell you what I did, but I do not really know the data. I don't. It's like I don't care. I want to do what you're doing. I'm like, well, if you want to be my guinea pig, be my guest. So I did that. And total of 50 people enrolled in Facebook, friends of mine. So I'm not scared about liability. It's like you're getting into this under your own risk. I mean, I'm just telling you. It's like, man, I mean, you're my brother, you're my cousin. That's fine. And case after case after case after case, everybody showing tremendous results, improving their lipid profile. Every variable of the metabolic syndrome is improving. I'm like, what the hell is going on here? I mean, I was really, really shocked. One of the things that is important to mention here is like, why was everybody improving? Because everybody was motivated to change. I think that is the key. So when people ask me about ketogenic diet, low carb lifestyle, is it sustainable? Well, that's not the first question that you should answer. I have arrived to this conclusion. The first thing that you need to ask is, how motivated are you? Why are you making the change? If you do not know why you're making the change and you just think it's because you're getting healthier and that's your goal, no, you're gonna fail. You're gonna go back to eating crap, and that's basically my experience. So I'll talk about that in a minute on how I approach the matter. But once I saw those results, I'm like, this is time to start digging deeper. And I think the first couple of books that I was reading on that time was David Perlmutter's Grain Brain, and then Jason Fung's Obesity Code. And I contacted Jason Fung, and he has been very helpful. I mean, he gave me recommendations, and I just then started reading more and more, and then I did this course of the Nutrition Network with Tim Noakes and amazing speakers there. Actually, that was the first time I saw Brett Scher and Brian Lenskys and, well, I mean, a lot of the low carb people. So I looked at what they were presenting. I looked at all the articles that they were presenting. So after they gave the talk, I went and I started like looking at the research and looking at the papers, and paper after paper after paper. I mean, now I have a huge library, and it is just shocking how the data is there. So once you have the data, now you have the courage to implement. And why? Because you're not making anything up. I mean, this stuff is there. There's publications left and right, and how it can improve basically every variable of the metabolic syndrome. And I live in McAllen, Texas. Most obesity in the United States. I mean, the obesity in kids, diabetes, even Hispanics have a predisposition for fatty liver. So you can imagine the catastrophe that I see here. I see patients at 30s, 32, 33, 34 having heart attacks. And that's the moment when I realize, you know what, I need to, I mean, I'm an interventional cardiologist. I'm trained to open up the vessels, but no, I mean, what's the point in opening up a vessel if it's going to be occluded again in a year? Now, I mean, so the satisfaction that you get as an interventional cardiologist, I think, varies tremendously depending on where you are. If you're in California and you get an 80-year-old who has been healthy and you saved his life, you know that he's going to live a healthy lifestyle. I see a 30-year-old with a heart attack. He's going to be back in a year if I don't change his lifestyle. So I need to figure out, or I needed to figure out how to do this. And once the knowledge was there, and patients actually started asking me, it's like, what are you doing? I mean, I'm doing something different. It's like, well, I want to do what you're doing. And it wasn't until I had significant amount of knowledge, and you have to be comfortable and know that the data is there to implement it with your patients. I don't think there's a physician out there that can easily implement this to their patients if they haven't read, because with the knowledge that we come out from med school, from fellowship, from training, from residency, it's not enough. There's no way on earth. I mean, I would be, scared to actually implement it. So you need to read, learn, but now I think things have changed. I mean, I think it's tremendously important that the American Diabetic Association has incorporated low carb into their guidelines. And if you look at what's going on, if you see all the lifestyles, they're actually saying that it is the lifestyle that has the most amount of research and data regarding the treatment of diabetes, type 2 and obesity. If you see at the parameters that it's helping, it's glycosylated hemoglobin, weight loss, triglycerides, HDL improvement, lipid profile improvement. So now there's really no excuse. And if somebody says low carb is not sustainable, first of all, low carb can be Mediterranean, can be vegan, can be pescatarian, can be, you name it, you can just make a modification of it. So keto. Well, the problem is when people say keto, once again, they are already focusing on people chugging down the butter stick. When keto can be, let's have my nice broccoli with my cauliflower with olive oil, some olives, and let's have a nice piece of salmon. Who on earth would say that that is not healthy? Let's put some walnuts there. I mean, it's not. I mean, people that say ketogenic is first of all not sustainable. They just do not understand how to eat. I mean, bottom line, you have your vegetables, you have your nuts, and once you regain or recover your metabolism and your metabolic flexibility, you want to increase your carb intake, be my guest, increase your carb intake. Some people, some of my patients, after a while, and they feel fine, they start incorporating a little bit more of potato, of rice. Not a problem, but it depends on the individual. And we have to find what works best for each. So that's a quick down and dirty of everything, I guess.
No, yeah, no, that's awesome. So once again, it seems like most of the practitioners that actually acknowledge the benefits of this low carb keto lifestyle have almost all had some kind of personal epiphany first, because it's not what you get taught at college. It's not what you think, you know, as a doctor. That's not what you've been trained to do. And obviously that's something that we really need to change. I mean, we've published those clinical guidelines now for practitioners to use, which has become, you know, really, really useful and really popular for a lot of people. But it's only, you know, a few thousand doctors that have downloaded it and used it, and we need
even if you get it
beyond that.
I mean, in order for a physician to implement it or with their patients, he needs to do it himself. Right. I mean, there's no way on earth, I think, that a physician can actually recommend it without experiencing it himself. Without knowing what low sodium feels like, without knowing what a cramp feels like. I mean, as I told you, I did this on my own initially. So I did every stupidity that you can imagine. I mean, I did not take enough sodium. I was not taking magnesium. I mean, I had cramps. I had twitching. I mean, and the data is there. I mean,
Yeah.
So we just need
Take a
to,
bit of salt and suddenly all of that goes
everything
away.
is
I was
exactly.
the same. I was like 3 months into it, like really struggling with low blood pressure issues. And and then I learned about the salt thing,
Yeah.
and I went into the kitchen and I took like basically took a handful of salt and washed it down with some water. And like within half an hour and I've never had a problem with it again. It's
Well,
crazy.
it's very interesting because one of the things that I started noticing when I was doing this is that I started having cravings. I started having cravings for tomato with salt. It's like, why the hell would I have cravings? You
Salt.
have your potassium in your salt.
Yeah.
For some reason, I was actually I used to use no salt, which is a potassium supplement for salt, because I'm a cardiologist and I'm supposed not to be taking salt, right? So, I mean, I was doing everything that I was told not to do. I mean, I was eating the saturated fat of the ribeye, and I was eating bone marrow, and I mean, like, trust me, when I was doing this, I'm like, what the hell am I doing? But when I saw the labs, it's like, holy cow, like triglycerides of 40, HDL of 90, LDL, they go up a little bit, about 80, I mean, to 90. I don't know. I mean, I couldn't care
Yeah,
less,
but when
honestly.
you listen to people like Dave Feldman and the people that are really doing research on this, and it's becoming more and more apparent that the LDL is not a
This is the way I see it.
good marker.
And let's say even the factor that, oh my God, LDL is going up. Okay, let's be realistic here. Insulin sensitivity improves, so insulin goes down, which, by the way, that affects your coagulation pathway. The same applies for hyperglycemia. Hyperglycemia goes down, which also affects your coagulation pathway. Your blood pressure goes down. Your HDL goes up. Your triglycerides go down. You lose weight. You're more energetic. I mean, I have 7 against 1. I mean,
Exactly.
uh,
Exactly.
so I'm not saying that LDL is not playing a role in atherosclerosis, but so are the 7 guys here. I mean,
Yeah,
so
it's all in context. In a low carb environment, it's one thing. If you're still eating a bunch of carbs, then all bets are off. Then LDL could quite possibly be
and
a
let's
big
say
issue.
I have a patient that is really concerned. They don't want to take a statin. You know what works great? Psyllium husk and red yeast, which to a certain extent it works like lovastatin, or I don't know what statin, but I mean, uh, psyllium husk, just fiber. I mean, it can decrease. I mean, I've seen it 20%. I've had patients decreasing their LDL
Wow.
from 200 to 100 just with psyllium husk and red yeast. So it's like, if we get to a point about worrying about LDL, we need to take all the other variables into context. I mean, we could just not say that the LDL of a metabolically inept individual is as harmful as somebody like, I don't know, Zach Bitter, or like a
Yeah.
ketogenic super athlete,
Yeah.
which is a lean mass hyperresponder. I mean, we do not know that information, and will we? Uh, I don't know. It's going to be tough doing a randomized control trial about that. But
Yeah, no, that's the thing. It's like, the ethics come in here as well. You can't kill a bunch of people to try and to show that a particular thing works or doesn't, right?
and in my case, migraines are gone. I've suffered migraines since I'm 12. Even if my cholesterol was 220, I wouldn't give a crap. I'm not kidding. Why? Because my migraines were, I mean, I suffered. I
Yeah.
suffered for 25 years or more with those godforsaken things. And this way of life for me has been a life changer. So it's it's taking things into consideration, and educating the patient, and making an assessment and how we're going to approach the matter.
Yeah. Well,
So
that's brilliant. It's so cool to have. It's always good to have more cardiologists like you and Brett Scher on board, because it's always the first excuse that people come up with when you start talking about it, low carb, because that includes increasing the fat intake. It's like, oh, I'm going to have a heart attack, and it's really good to have educated cardiologists now that can point to that and say, no, actually, maybe not so much, that there's more involved in this whole thing than just LDL.
it's about health. It's about how you are. I mean, initially my colleagues are like, "You're going to kill somebody," but then they started sending me their parents to me.
Yeah.
I mean, that's
Yeah.
I don't think there's more accurate assessment of what you think about a physician. If you're sending him your parents, that
Yes,
says a lot.
totally. That
So
says it. Yeah.
yep.
So, Christian, thank you so much for being a part of this. I'm super excited to meet you in person and hear what you've got to say at our event in Boca Raton in January.
Yeah, it's
And
gonna be a pleasure.
just if people want to get hold of you, maybe just I'll put it in the show notes as well. But just if you could verbalize it here, your Twitter account and TikTok and all of that stuff.
Yeah. Yeah, I mean, people can find me anywhere basically. I think that the one I stopped using is LinkedIn. That just annoyed me, you know.
Yeah.
So I'm not active in LinkedIn at all. I mean, that's
Okay.
buried. But if they want to find me, I have um it's webpage medhacker.com. That's where I actually did the post when I was first experiencing this, and I thought I developed the holy grail. So I mean, but it's a very good post. That you can also find me on Twitter, Christian Assad. I'm very active in Twitter, Instagram, MedHacker, TikTok. Yeah, I'm in TikTok as well, MedHacker, and Facebook as well. There's a cardiometabolic clinic page. So so there's so many networks now that I might take some time in
Can't even
answering,
keep
but
up. Yeah, I'll put a few of them that I know about in the show notes.
yeah,
And thank you again for being with us and look forward to meeting you next month.
yeah, awesome. It's gonna be a great event, no doubt about it.
Cheers, mate. Thank you. And if
It's
there's
an
a bit of time at the end, I might bring up the thing of your dancing on the desk.
yeah, I'm doing
Mainly because of your comment that you were doing it to try to get the attention of the kids.
It
And
is, and
I
it's
think that's
working. I mean,
really important.
I did like today, and I did another video, and it already has 15,000 views, and people are commenting. I mean, I have more followers right now in TikTok than I do in Twitter and Instagram and Facebook than I've ever. I mean, and I've been there for 7 years, and people are commenting that the kids are interested. So what I do is, if you put a simple video of information, nobody's gonna watch it.
Right.
You have to have a lure. You have to need a bait,
Right. Yeah.
and I looked at the platform. I saw what these kids were doing. I'm like, you know what, the hell with it. I'm just gonna try a couple of things, and I tried that stuff, and it had like 450,000 views.
Wow.
So after that, I get like 10,000 followers. So I did like an informative one. Of course, the informative ones do not have the views that, but still, I mean,
But
I'm hitting people.
yeah.
I'm reaching people, and that's the point. I mean, it's not the point of looking like a jackass, which to a certain, I even enjoy the dancing and everything. So,
No, it was fun.
uh, so yeah, I mean, it all it's based on a paper from 2011, which is tracking obesity in social networks from James Fowler and another author, which I forgot. But obesity can be spread through social networks. So I
Right.
always had this concept: what if I can spread health through social networks? You know,
Right.
and people are saying I'm motivated with your enthusiasm and stuff like that. And I mean, I'm just playing around with things, and
It's just so important, because there's so much talked about here, in this environment about the therapeutic benefits of the keto diet, and it's always talking about fixing diabetes and cardiovascular disease and Alzheimer's and all that stuff. But to me, if people ate right from the beginning, then they wouldn't get sick in the first place.
true.
And I think it's so important that that we start trying to target the people before they get sick than just trying to help
100%.
the people that are now sick.
Yeah, yeah. I
Um,
mean, no doubt about it. And the thing is that what got me into it is my cousin is the most obesity in the United States. I see the kids. The kids weigh more than I do in my Walmart. I mean, it's a catastrophe waiting to happen.
it
I mean,
is.
so if I'm just playing around with concepts, having fun with them. If they work, fantastic. If they don't, hey, I reached a couple of people. No
Yeah,
harm
no.
done.
Well, yeah. I mean, 10,000 followers and 450,000 views is more than a couple of people. That's pretty awesome, man.
Yeah, it's pretty cool. And Troy is also getting involved and then putting his stuff there.
Yeah, I
So,
saw him doing a funky little video thing like
you
that he
know,
was going to put on TikTok as well. But yeah, I mean, throw mud at the walls, and if it sticks, that's cool, man.
Yeah, exactly.
Yeah.
So have fun while you're doing it. So
You've been listening to an episode of the Low Carb USA podcast. You can support us on Patreon at patreon.com/lowcarbusa.